I myself was in a secure unit for about 5 years, from 2007 to 2012. And while I was there, one of the things that became apparent was that my family weren't really being as well involved or supported. They didn't really know what was happening in the hospital. And sometimes you just need kind of more support from people who, after all, have known you all your life.
Carers, friends and families are a vital source of expertise, information and support. They can help in many areas, from the care of their loved one, to the development and running of services, to influencing how services should be designed and commissioned. Ideally, the journey should begin with a dialogue, doing things such as allocating time to listen, asking how they are coping, reassuring them, checking they have the relevant information, asking if they have questions or concerns, and giving them space to talk about their loved one will help carers, friends and families feel more involved. A clear working relationship can be established by giving usable and relevant information. It's useful for carers, friends and families to know who they can contact for different issues. There should be clarity around when carers, friends and families will be contacted regarding the patient's care. If they know dates of events like tribunals, risk assessments and discharge planning, for example, they can seek advice and information so will feel more prepared and able to plan ahead. When patients don't want their carers, friends and families involved, staff can always share general information and provide opportunities for feedback. Carers, friends and families should be encouraged to make a difference and to get involved. They can help improve and develop services so they are better for carers and service users. Carers, friends and families can offer a lot to discharge or transition planning, and their views should be taken into account. Building on the Care Programme approach, also known as CPA, can help this process. Involving carers, friends and families throughout the whole journey helps improve and develop services. NHS England is committed to supporting carers of patients in secure services and welcomes their input.
How do you think the best way we could go about carers and commissioners working together?
As you know, the last few years there's been a huge impetus around networks of service users in secure mental health services working together, and commissioners have been really integral in taking that forward. Now, I do think there's probably mileage in doing something similar for carers, giving them that opportunity to come together to influence the way services are delivered and organised, and also to get support from one another.
It would be really helpful for carers, I think, to have peer support groups, as we're talking about peer support workers for service users, because as carers, the most important people in our lives are the people who are in secure services. Yeah. But there are times when we need to sit down and say, actually, sometimes I don't know if I can cope with it any longer. And if I can say that to somebody and have a phone call with a friend that I've made there, it makes things a lot easier.
Carers, friends and family will also be lawyers and bankers and accountants and nurses and doctors in their own right. People come with their own ideas that are well informed from their lives, and we need to use that and work with that and see it as a real positive attribute.
Unless there's a really good reason, we should use them as part of our care team.
I think there's a place for carers in service development, in policy development. I think it should be systemic.
They understand the situations that they've been in, their loved ones have been in, and they know what's really important in terms of how those services are delivered, but also in terms of what are the key aspects that will help their loved ones move through services and have a successful discharge from services. So I think because they hold that key information, they're vital to the work that we do.
These short films are really a taster or a hook to get people's interest. And what we want is that people will turn their attention to the other materials that we've made in the project, which will illustrate ideas for innovation and change.
The other materials in NHS England's resource pack include information on meeting carers' needs and involving them, with best practice examples from services. For more information and to access NHS England's research findings and advice, visit www.england.nhs.uk/Secure Carers Toolkit.